Dear students, I greet you. I am Dr. Ibrahimova from Department of Pathological Physiology of Azerbaijan Medical University. I want to explain the topic, the role of external and internal factor in pathology. The cause of disease are external and internal etiological factor, influence of external environmental factor, physical factor, chemical factor, biological factor, social factor, psychical factor, and other factor. Internal factor, for example, heredity, age, sex, constitution. And internal and external factor play a role in the development of disease. Influence of external environmental factor and influence in the organism from air, water, and soil, and enter in the skin, in the lung system, and digestion system, and form storage disease. Influence of external environmental factor, mechanical factor, and form mechanical trauma, compression and rupture of tissue, and etc. Influence of sound, vibration, and ultrasounds, influence of atmosphere pressure, and form mountain sickness causing disease, influence of heat and cold, influence of electric current, influence of ionization radiation, and form radiation sickness, influence of gravitation. Local mechanical trauma manifests itself in the form of explosion and rupture, fracture, or a combination thereof. General mechanical trauma manifests itself in the form of blood loss, traumatic toxemia, traumatic shock, and prolonged crash syndrome. Crash syndrome or ischemic toxing has several stages: early stage and continuation 3 days. There are general signs of shock. Intermediate continuation and from 3 and to 12 days, acute renal failure observed. Late stage continuation from 12 days to 1 month, local signs and absorbed. Under the influence of a mechanical factor, violation on the integrity of tissue is called damage. Stage of damage, primary stage, activation of the sympathetic nervous system, adrenal secretion increases. This leads to the decrease in membrane permeability. Regeneration decreases. Blood coagulation in the vessel increases. There is an increase in the concentration of anti-inflammatory hormones, for example, glucocorticoids. And second stage, activation of parasympathetic nervous system increases the secretion of mineralocorticoids and increases of the regeneration. Influence of sound and noises. Pathogenesis affect if sound and noise. Noise, sound, or a combination of sound that have an irritating effect on the human body and reduce its work. The woman ears perceives sound with an oscillation frequency of 15 to 20,000 Hz. Human ears perceives sound vibration of 16 to 20,000 cycles per second. Permissible level of noise for woman ear is 40 and 50 decibel during normal speech. The sound stimuli of 80 and 100 decibel cause pain in the organ of hearing. More intensive noise decreases hearing and may lead to hearing loss. Sounds level more than 180 decibel are fatal for organism. Frequency above 20,000 Hz is called, this process is called ultrasound, and frequency below 16 Hz, this process is called infrasound. Infrasound occurs in earthquake and explosion, storm, and etc. and 7 Hz long infrasound is dangerous to health. High frequency infrasound vibration in tonal organs and cardiac arrest is often observed. Low frequency infrasound affects the middle ears, signs the motion sickness are observed. Medium frequency ultrasound affects the digestive tract, brain, blindness is observed. Ultrasounds has a medical and diagnostic character. Ultrasounds has a mechanical, thermal, and physiochemical effect. Mechanical effect is, in this case, ultrasounds spreads into the tissue. Cavitation, the formation of microscopic cavities with the rapid collapse. This is accompanied by hydraulic fracturing. Cavitation leads to the destruction of molecule cells, liberation from lipids with liposuction, fragmentation of gall and urinary stones. This process is called lipotrophy. And action of barometric pressure and mountain sickness. With a decrease in atmospheric pressure, may form mountain disease and a high altitude disease. And the mountain disease develop gradually, and high altitude disease develop acutely. Mountain sickness develop in the altitude more 5,000 meters. Lowered atmospheric pressure, decompression, and decreased partial pressure of oxygen in the air lead to expansion of gases inside confined space of organism, and sinuses of nose, frontal noses, and the pleural and abdominal cavities. Transition of formally dissolved nitrogen to the gaseous state and the formation of gas embolism, which lead to ischemia of tissue. Pathogenesis of mountain sickness, including the following process: hypoxemia, and then hypoxia, then hyperventilation of lung system occurs. After form hypocapnia and gaseous alkalosis. Next, decreases of activity of respiratory center and central nervous system, which may lead to paralysis and death of the organism. And the effect of change in low and atmospheric pressure on the body is shown in this slide. And attitude diseases is formed in a violation of the tightness of the apparatus. In this case, the compression is absorbed in blood and tissue. Dissolved gases pass into the gaseous state, forming bubbles desaturation. They dilate in the blood and tissue. A gas embolism is absorbed. Attitude diseases may form edema, attitude pulmonary edema, and in time and form severe hypoxia, activation of sympathetic nervous system, increasing of pressure in the capillaries of pulmonary arterial system, increasing permeability of capillary wall, and form non-cardiogenic edema of lung system. In the acute diseases and change normal function of brain, and acute brain edema form hypoxia, activation of sympathetic nervous system, and increasing the hydrostatic pressure in the microvessel, increasing vascular permeability, increasing in blood-brain barrier permeability for bradykinin, and dilation of brain vessels, and form headache, vomiting, and nausea. An action of elevated atmospheric pressure, this process is called hyperbarism and may form caisson disease. Hyperbaria compression leads to increasing dissolution of gases in the body fluid. This process is called saturation. Caisson disease developed during rapid return from elevated to normal atmosphere pressure. The gases, especially nitrogen, formally dissolve air liberation in the form of bubbles, desaturation, and may cause gaseous embolism. And the hyperbaric oxygen therapy, breathing of oxygen under the increasing pressure. Action of low temperature may perform frostbite and hypothermia. In the frostbite, local disturbance caused by action of cold. In the hypothermia develop as a result of general effect of cold. And depending on the low temperature, various pathological processes develop in the body. With hypothermia, increasing heat loss or heat production decreases. Hypothermia has two-stage compensatory and decompensatory stage. During compensatory stage, spasm of blood vessel of the skin occurs, and sweating decreases, breathing slow down, heat production increases, muscle tremors occurs, accelerate of glycogenolysis in the liver and muscles, and form hyperglycemia. Main metabolism is accelerated. With the compensation, the body temperature and the intensity of metabolic process decrease, muscle tremor cease, peripheral blood vessel expand. As a result of inhibition of the cerebral cortex and subcortex, blood pressure decreases, heart rate and breathing slow down. Death occur from paralysis of the respiratory center. The action of heat is local exposure to high temperature, and in time form burns. Burns local tissue damage when exposed to the environmental factor with a temperature of 45 and 50 degree. Maybe influence in the organism and hot water, heated metal, fire, and etc. General effect of high environment temperature are hyperemia or overheating, and next heat stroke and sunstroke. There are 4 degrees of burns. Redness of the skin may form erythema. Next, formation of vesicle. And next, portion of complex necrosis, Malpighian layer of the skin. Next, complex necrosis of the skin, and finally necrosis of the skin and underlying tissue. Burn disease develop when more than 10 and 15% of body surface damage by this process is called second degree of burn. The following phases of burn diseases are distinguished: burn shock, burn toxemia, burn septic toxemia, burn immersion, and outcome of diseases. In the burn shock, primary activity sympathetic nervous system and increased adrenaline, and primary may form erectile force, and next increasing activity nervous system. And formation toxic substance and toxic substance enter in the organism. This process is called burn toxemia. Then toxic element circulation in the body and form septic toxemia. Next form burn emaciation and outcome of this disease. Hypothermia occurs as a result of the action of high environment temperature or violation of the processes of heat metabolism of the body. and characterized by the violation of the mechanism of heat regulation, increase in body temperature above normal, and maybe have two-stage and compensation or adaptation stage and decompensation. In the decompensation, acute hypoxia, acidosis, imbalance of iron, hyperhydration of the body, and toxemia, destruction of cell and tissue. The main causes of death of hyperthermia. And ventricle fibrillation, cardiac asystole, and form respiratory arrest. In the compensatory stage and dilation peripheral vessel, and heat produce is increasing, then heat losses is increasing, then heat produce. And acute overheating of the body with a quick and acute increasing in body temperature and prolonged exposure to high environment temperature can cause heat stroke. In the heat stroke, cardiovascular system disorders, neck disorders, and nervous system, and lowering blood pressure, tachycardia, vomiting, and loss of consciousness occurs. In the sunstroke develops as a result of the direct action of the ultraviolet radiation together with the terminal effect of sun's rays on the body. In the sunstroke primary disorders nervous system, the cardiovascular system disorders next may be from hypoxia and heart failure. And heat collapse in the heat stroke, increasing temperature of the body, maybe from vasodilation of the peripheral vessel and sweating increases. And if the organism loses a lot of water, maybe from dehydration, and cardiac output decreasing blood pressure, maybe from weakness and nausea and dizziness, and the organism loses consciousness. If increases brain temperature and maybe from and failure of heat loss and dry skin and heat formation heat stroke, and next accumulation energy water in the cell intracellular space, maybe from cerebral edema. And next disorders nervous system, maybe from death of the organism. The action sun exposure, ultraviolet radiation exposure between the 10 and 400 nanometer wavelengths. Infrared radiation affect more than 720 nanometer wavelengths. Under the influence of infrared radiation, local inflammation is absorbed. The body temperature rises. Mutation isn't occur. The range of ultraviolet radiation is divided into 3 layers, and first layers long wavelengths and between 400 and 320 nanometer, and next medium wave between the 320 and 280 nanometer, and C air and shorter and wavelengths 280 and 200 nanometer. Region A and fluorescence under the influence ultraviolet radiation formed melanoma is a protective agent factor. A B accelerated growth, tissue regeneration, anti-rachitic effect, and A C and have bactericide effect. Excessive ultraviolet radiation exposure causes photophthalmia, photosensitivity, and photoallergy, and etc. Patient with pigmentary xeroderma possess a high sensitivity to ultraviolet radiation. On the skin, carcinoma is formed. Photosensitized enhance the effect of ultraviolet radiation. Exogenous photosensitizers, eosin, rivanol, and endogenous photosensitizers, for example, bile acid, cholesterol, hematoporphyrizing bilirubin, and etc. in people with a high content of porphyrins in a blood system, and skin burns occur after exposure by the sun. Under the local action of infrared radiation, vascular permeability increases, the vessel expand, exudate form under the general action, accelerate metabolism, and favor organism. The effect of ionization radiation on the body, initial action and first stage, free radical are formed, and the next metabolism is disturbed, and etc. The effect of radiation on cell, and this stage is second stage. Cell proliferation increases, cell differentiation decreases. Radiosensitive tissue is descending order, lymph nodes, spleen, thyroid gland system, bone marrow, and gastrointestinal mucosa, and skin epithelium. Resistant organs against ionization radiation, and cardiac and muscle and bone tissue. The effect of radiation of the bodies is called third stage, and form local and general disorders. In the local disorders, from burns and necrosis, cataract, and general radiation sickness. And ionization radiation factor influence in the organism, and ionize and maybe form and direct and indirect effect, and ionizing radiation influence in the DNA, and DNA damage after failure of repair DNA, and form inhibitors of cell division and cell death, and form and cancerogenesis and change normal function of cell. The form of radiation sickness, and radiation sickness have several forms, and gastrointestinal form, hematopoietic form, and cerebral form. In gastrointestinal form, absorb dose 10 and 50 gray, and hematopoietic form absorb dose and to 10 gray, and cerebral form absorb dose 50 and 200 gray dose. And in the in the state of the acute radiation sickness, and have several stage, initial stage, and continuous, and from 1 and 3 days, and latent stage, and 10 days, and for 4 weeks, and stage of market manifestation from maybe 2 and 3 weeks duration, and next outcome, and this continue and 3 and 6 months. In the initial stage and short term, and neutrophilic leukocytosis, absolute lymphocytopenia, and headache, nausea, and vomiting, and anorexia occurs. And later stage, the patient is satisfactory with severe forms observed, aplasia, leuko, and lymphocytopenia. And third stage of Marked manifestations, the stage of health worsens, leukopenia, thrombocytopenia, anemia, and etc. Outcome of diseases, duration of, I say about it, 3 and 6 months, and effect of radiation and radiation causes pathology by affecting various organs, for example, brain, skin, lung system, lymph node, gastrointestinal tract, and blood system, and in the bone marrow, and change normal structure, change normal function, and organ and system. And chronic radiation sickness occurs when the long-term exposure of low doses, those excess uh, of permissible norm. There are two main options due to external exposure and general hypoplasia in the hematopoietic tissue, mutation of local cells age and die, and due to internal exposure. And the stage of the chronic radiation sickness have several stage and initial stage in term formation leukopenia, thrombocytopenia, next stage and complication and disorders of bone marrow and bone marrow hypoplasia occurs, and period of irreversible change and form disorders in the organ and system. Spaceflight factors, and on orbital flights, a person is exposed by the effect of weightlessness and hyperkinesia. Disorientation, dizziness, and nausea, and vomiting, salivation, unstable pulse, and blood pressure, and absorbed. As a result of a hydrostatic pressure loss, redistribution of blood occurs evenly on the blood, on all blood vessel of the body, with an increased blood vessel in the upper half body. With blood filling of the cavities of the heart, secretion of natriuretic hormone increases, then sodium and water is lost, blood volume decreases, heart function is relatively is improving. This is called Henry cover reflex, with weightlessness and hyperkinesia, and calcium, phosphorus are removed from the body, and osteoporosis develops. Skeletal muscle mass decreases, atrophy is absorbed. Electric trauma influence in the organism may perform burns and disturbance of heart rhythm and breathing arrest, have several effects: electrobiological effect, electrochemical effect, electrothermal effect, and electromechanical effect. In the pathogenesis of electric injury play an important role. Electrobiological effect, excitation of the central nervous system, more catecholamine increases, respiratory arrest, and etc. Electrochemical effect may perform electrolysis of tissue, protein denaturation, coagulation, necrosis occurs. Electrothermal effect may perform burns on the skin, on the organ, and electromechanical disorders effect may perform a violation of tissue. Influence in the organism, biological factor, for example, microorganism, and influence and a chemical factor and several poison factor, and mental and social factor, mental and social factor, and negative emotion and bad habits and eating disorders and overeating, and social factor, for example, nicotine influence in the body, and there is a release of catecholamines, and then spasm of small vessels, and blood pressure is increasing, accelerate respiration, increasing gastrointestinal secretion. And cigarettes contain a large amount of monocarbon monoxide, and carbon monoxide combined with hemoglobin and greatest hypoxia accelerates platelet aggregation. Next is influence in the organism and the organism drink and alcohol. The toxicity of alcohol depends on the effectiveness of acetaldehyde dehydride. When ethanol is converted to the acetyl dehydride, the formation of NADH increasing and not decreasing. NAD is essential for the oxidation of the fatty acid in the liver. Fat accumulation in the liver is caused by the lack of a NAD. This creates a fatty infiltration uh, and degeneration. And biological factor and infection factor influence in the organism through barrier system, from skin, from mucous system, from and throat and lung system and intestine and urinary tract system, and enter in the lymph node after, and then bloodstream circulation in the body and influence in the nervous system, maybe from polymyelitis, and enter in the skin, maybe from chickenpox, and maybe influence in the lung system, maybe formation measles and pneumonia, and influence in the kidney, maybe from pyelonephritis, and maybe influence in the salivary gland system, and from mumps, and influence in the liver, maybe from hepatitis B and yellow fever. Internal factor influence in the organism. Role of internal factor is origin of disease, and constitutional factor, hereditary factor, age factor, and sex factor. The constitutional is complex of acquired and hereditary morphological and functional properties of organism, and determines the individual reactivity. Constitutional type has several forms: asthenic form, normasthenic form, and hypersthenic form. Next, constitutional type by Hippocrates and phlegmatic form, melancholic form, and choleric form, and sanguinic form. And constitutional pathology includes diathesis and predisposition to the disease. Diathesis is an anomaly of the constitutional, and characterizes the abnormal reaction of the body to pathological and physiological stimuli. Diatheses have several forms, and exudative diathesis, and exudate inflammation, and parasympathetic nervous system activated. Lymphohypoplastic diathesis and hyperplasia of thymus, allergic reaction of adrenal cortex to stress are weakened. Spasmophilic diathesis and tetany, and disturbance of potassium metabolism, and increasing neuromuscular excitability, hyperfunction of parathyroid gland system, and asthenic diathesis and adenomia, vascular tone, and neuroarthritic diathesis form. Hereditary diseases, and hereditary diseases develop after the burns and during the life. Familial congenital diseases present at birth, and DNA damage during mutation. Mutation in sex cell are transmitted to the progeny and may give rise to inherited disease. Mutation in somatic cell are transmitted to the progeny. Type of variability, and have several form, and phenotypic form non-inherited modification and form phenocopies, and genotypic form inherited form and mutation genetic and have somatic and generative and sexual form. And phenocopy is a symptoms of the disease that formed under the influence of certain environmental conditions. The main cause of hereditary diseases is mutation. Mutation is a sudden change in genetic information. There are several mutagenic factor, endogenous mutagenic factor, and exogenous mutagenic factor. Endogenous factor, for example, physical factor, chemical factor, biological factor, and etc. And next, by cause mutagenesis and maybe spontaneous mutagens and induced mutagens and form artificial form. And next, by meaning pathogenesis, mutagenesis, and natural mutagenesis and favorable mutagenesis. By location, somatic, sexual, mosaic mutation, type of mutation, and genic mutation, and chromosomal mutation, and genome mutation. I won't explain this. And spontaneous mutation influence after injure exogenous endogenous mutation factor without special intervention a person, and induced mutation or artificial mutation can to be controlled and purposefully, for example in an experiment and in controlled with developed by chance when radioactive and element are released into the environment and etc. By localization, somatic mutation occur only in the body then receives the mutation, and sexual mutation can occur only in subsequent generation, and mosaic mutation result from redistribution of genes, mutation, or incorrect chromosome and divergence or cell have a different genotype. By meaning, pathogenic mutation lead to the death of the embryo or to the development of hereditary and congenital diseases. Natural mutation don't affect the life of the body, maybe change in hair color. Favorable mutation increase the body's vitality and maybe from dark skin color in Africans. By skin mutation, there are gain mutation, chromosomal mutation, and genome mutation. In the gain mutation, structure change of DNA, and chromosomal mutation structures change individual chromosome, and genome mutation chromosome number change. This slide shows a normal chromosome set and genetic mutation. There have type form and deletion, loss of DNA segment, duplication, and doubling, repetition of the DNA segment, inversion, rotation of 180 degree segment of the DNA, inversion, addition of one or more, and nucleotide into DNA, transversation and substitution of a purine for and pyrimidine and or vice versa. Transition substitution of one purine and another purine or pyrimidine for another pyrimidine. Type of chromosome mutation. And inside there are several forms inside the chromosome, and occur deletion, inversion, and duplication between chromosomal mutation and translocation. Robinson connected of two acrocentric chromosomal to the centromere, and next type is either chromosomal mutation transfers rupture through an centromere. and chromosome mutation are shown in this way, and the way there we see an chromosome mutation, and very interesting slide. Next type of genome mutation, there are polyploidy and aneuploidy, and hereditary diseases have two types: monogenic diseases and polygenic diseases. And according to the way of inheritance, the genic diseases are autosomal dominant, autosomal recessive, and adhesion to the X chromosome dominant inheritance, and adhesion to the X chromosome recessive inheritance, and coupling with a Y chromosome inheritance, and imprinting and form Angelman diseases and Prader-Willi disease, and mitochondrial inheritance, and the expansion of trinucleotides repeats, and etc. And a rule of autosomal dominant, autosomal recessive, and co-dominant transmission of disease. And there are autosomal dominant disease and transmitted disease are indicate, and there are several autosomal dominant disease. And autosomal dominant disease and men and women are equally and homozygotes and heterozygotes. Transmission of a pathological sign is possible from both parents, and lesion rate of 50%. Autosomal and dominant gene and diseases are phenotypically observed in homo and heterozygotes. And there are autosomal recessive disease and X-linked recessive disease and X-linked dominant disease, and transmitted this disease are indicated. And autosomal recessive type and men and women are equally sick. Male parents of a sick child, relatives, parents of a sick child are phenotypically healthy, are heterozygotes carries lesion frequently 25%. If of the patient is sick, the children are phenotypically healthy. If one of the parents is sick and the other carries, the children are 50% sick. And autosomal recessive disease may be phenotypically and observed in homozygotes. And phenylketonuria transmitted by autosomal recessive way, they are increasing phenylalanine and appear phenyl in the urine, and form phenylketonuria and decreasing melanin and form light sensitivity and form mental retardation in the body. And disorders phenylalanine, decreasing tyrosine, decreasing formation DOPA and tryptophan and melanin. If decreasing of melanin and change normal color of skin of eyes and hair, and if decreasing DOPA and change plasma level of catecholamines, and decreasing tryptophan and decreases level of serotonin. And there are and X-linked recessive and diseases, X-linked recessive and X-linked recessive and affected father and carrier mother, and transmitted disease are indicated. And X-linked recessive disease pathological gene is transmitted from father to daughter, from mother 50% to son. Women rarely get get sick only from a heterozygous father, and from a heterozygous mother a sick daughter is born. And next, and X-linked dominant and affected mother and affected father, X-linked dominant and X-linked affected father and affected mother where transmitted diseases are indicated, and X-linked dominant disease both man and woman are affected. Women suffer 2 times more than men. Next, genetic disease aren't related Mendelian, an inherited disease that don't couple with Mendelian's law, the phenomenon of imprinting, fingerprint, and genes obtained from parents is active and inactive. The disease is observed from a mutation of active gene. For example, there are develop an Prader-Willi syndrome and Engelmann syndrome. In the Prader-Willi syndrome, develop upon division mutation of 15 chromosome, and 15 chromosome is active gene of the father in form mental retardation, muscle hypertension, and hypogonadism. And next, Angelman disease and or happy doll disease develop during vision and mutation of 15 chromosome and active chromosome of the mother. Next, there are mitochondrial inherited disease. Mitochondrial inherited is transmitted from the mother, and 2,500 mitochondrial from the mother, and a little among, maybe 4 among, and mitochondrial from the father. And there are develop disease and liver optic atrophy and mitochondrial myoencephalopathy and several form. Next, expansion of repeated triplets and neuro-degenerative processes. Anticipation, the disease warns in the next generation and increasing in the number of repeated triplets and lead to the development of the diseases Martin-Bell syndrome. Chromosome diseases have 2 types and are abnormality of autosomal chromosome and abnormality and sex chromosome, and there are develop and Down syndrome, Patau syndrome, Edwards syndrome, and Turner syndrome, and Klinefelter syndrome, and there are chromosome set of Down syndrome. In the Down syndrome, from trisomy 21 X chromosome, and maybe from translocation between the 21 and 14. And the syndrome is Edwards syndrome. In the Edwards syndrome, trisomy and 18 type, and in the Patau syndrome and trisomy 13 type. Klinefelter syndrome is a Klinefelter syndrome, increased number of chromosome, there are and 47 chromosome, XXY chromosome, and only man with Klinefelter's disease, and next, and Turner syndrome. Next, Turner syndrome is a Turner syndrome and karyotype 45, and the woman organism have only one X chromosome. And next, phenocopia under the influence of external factor. There may be, if influence in the organism, alcohol and etc. pathological factor change in the phenotype, and from several pathological process, gargolism, and in the gargolism maybe and mucopolysaccharidosis type 1 and 2, and formation and Hunter Prodler inherited autosomal recessive of or inherited linked to X chromosome, and there may be cataract, kyphosis, and etc. And early deafness inherited in a recessive bidominant way, and next type congenital cataract inherited in an autosomal dominant way, and other. And the study of hereditary disease, and there are genetic disease and epidemiological method, and a method of clinical diagnostic and experimental method, and during pregnancy the diagnosis of genital diseases in the fetus. Next, reactivity. Reactivity is the ability of organism to respond to the factor of external and internal environment. The type of reactivity and biological reactivity, group reactivity, individual reactivity. Individual reactivity has several forms: physiological reactivity, pathological reactivity, or maybe pathological reactivity have several types: specific reactivity, non-specific reactivity. And specific reactivity manifested by the development of an immune response on the effect of antigen. Non-specific reactivity, phagocytic reaction, hypoxia, inflammation, and etc. Biological reactivity is formed under the influence of the environmental. The hemostasis of the body isn't changed, and maybe protease movement and toxins, instincts, seasonal migration of the fish and bird, hibernation, and group reactivity. This is a reactivity of individual group that determine and characterizes of age, gender, and blood type, and type of higher nervous activity. Individual reactivity exposure to the factor of women's or animals doesn't cause the same change in all individual. And individual reactivity may be and physiological reactivity, the hemostasis of the body isn't disturbed. The production of digestion enzyme in response to food, the natural emigration of leukocytes. And pathological reactivity, adaptation decreases, and hemostasis of the body is disorders. Classification of reactivity and group reactivity and sex reactivity and age and constitutional and individual reactivity. And individual reactivity we say about it, and have pathological reactivity manifests itself in the form hyperergy. Hyperergy have two forms: positive and negative, dysergy and anergy. Hyperergic reaction and excessive reaction to an irritant is manifested maybe from pneumonia, diphtheria, and high fever. A hyperergic reaction, a weak reaction, is manifested. There are positive and negative hyperergy, and positive hyperergia, the response is reduced. This is due to the development of active defense reactions, and antimicrobial immunity develop. And negative hyperergy response reaction also reduce while regulation the body's reactivity are inhibited, depressed, for example, poor epithelialization after the severe infection. Next, energy, lack of response to an irritant, maybe coma, immunological tolerance, and dysergy. And this is an atypical and reaction to an irritant factor, maybe expansion vessel in the cold weather. And resistant the ability of the organism to protect himself against to pathogenic factor. Type of resistant and active resistant and passive resistant, specific resistant and non-specific resistant. Active resistant, non-specific, for example, phagocytosis, an increase in the number of red blood cell. Specific is formation of antibody during infection. Passive resistant, insensitivity sensitivity to a pathogenic factor, destruction of bacteria by gastric juice, skin, mucous membrane, and etc. Resistance can be specific, for example, immunity, and non-specific and biological barrier, phagocytosis, and lysozyme, and etc. And there are factor of non-specific resistant and external factor. And the factor of non-specific resistance, there are external barrier system, including skin and mucous membranes, and internal barrier system, barrier of organ, liver, lymph node, and spleen, bone marrow, and thymus, and histohematological barrier system. And next, and the complement system, reactive protein, and lysozyme system, interferon alpha and beta and gamma, and natural killers, and macrophage phagocytosis system. And activation of complement system. Complement system is a serum protein system, consists 9 fraction of protein. The activation causes perforation of bacterial membrane, and the activation of complement system consists of classic activation and alternative activation and lectin activation. And classic or antibody dependent activation, and antigen antibody complex is formed and on the surface of bacteria. Next, and alternative pathway and or propertine pathway, and polysaccharides of bacteria and propertine causes complement activation. And next, lectin activation, proteases and for example trypsin, plasmin, and kallikrein. And finally, form complement fraction and complement from 5 to 9, and this factor is called membrane attack factor, and final analysis of microbe. Classification of form immunity, and there are congenital and acquired immunity. Acquired immunity have several types: natural immunity, artificial immunity, and next, and artificial immunity have active and passive immunity. And immunity is a way to protect the body from genetically foreign substance. Classification of immunity, we say about it: congenital immunity. Congenital syphilis in human isn't defected in this form in rabbits, and etc. Specialist immunity has a relative and absolute type. Absolute immunity and polymyelitis isn't detected in rabbit and dogs. And relative immunity, chickens isn't suffer from anthrax, but the disease can occur when the temperature of the chickens is low. This process depends on and conditions. Acquired immunity has a natural and artificial form. Natural active post-infection, and have several forms: passive and formation and in the placental. And artificial is acquired post-vaccination, and passive artificial introduction antibody. And there are innate immunity and adaptive immunity. Innate immunity including and take part and barrier system and phagocytes, macrophage, and complement system, and natural cell. And adaptive immunity in time activity B and T cell. B cell activate and form plasma cell. After activate plasma cell, secretion antibody. If activate T cell, and maybe proliferation T cell, and from T after proliferation and form effector cell and T cell, memory cell. And the immune system consists of central and peripheral organs. The central including bone marrow and thymus, the peripheral, the spleen, lymph system, tonsils, lymphoid elements of a number mucous membranes. Cell of immune system, for example, phagocytosis, phagocytes, and natural killer cell, B and T lymphocytes. And Zara and T helper, T killer, T suppressor. T helper have marker CD4 and T killer or cytotoxic cell have marker CD8. T helper secretion interleukin 10 with regulated the immune system. Dendritic cell during interaction with T lymphocyte secretion cytokines and interleukin 10, 12 and colony stimulation factor, and they activate T and B lymphocyte. And T helper 1 release the interleukin 2 interferon gamma, and TNF beta acts on bacteria, virus, and T helper 2 secreted interleukin 4, 5, 6, 10, 13 acts on helminths, and T helper 3 release TGF transforming growth factor, inhibits or suppresses lymphocyte proliferation. The lymphocyte and 10 and 20% have and CD 19 and 20 marker. This lymphocyte is called B. And next, and there are humoral and cellular immunity, humoral immunity in time activity and B cell, and in the cellular immunity activate T cell. If activate T cell secretion cytokine, and cytokine influence in the abnormal cell, normal cell, and next, if activated B cell secretion antibody connected with antibody antigen and absorption on the surface the mast cell, and activation of T cell, and there have HLA is formed in with blood cell. MHC1 measure histocompatibility complex. MHC1 located in the membranes of nuclear cell and platelets. Pathological cells and tumor cells connect to MHC1, and natural killer destroy these abnormal cell, and MHC2 expressed on the surface of antigen presenting cell, and MHC3 encodes proteins of the complement system and is involved in the formation of complement system 3. And T helper activation when a foreign vector enters the body, a non-specific defense mechanism is activated, and barrier system, natural killer, and complement system, phagocytosis, and next specific defense mechanism is activated, and MHC2 with phagocytes recognize antigen. The antigen binds to MHC2, and T helper is activated with the help of two signals. First signals, T lymphocyte receptor bind to an antigen that is in complex with MHC2, and the CD4 T lymphocyte bind to MHC2, and next And second signal consists and CD28 T lymphocyte bind to the CD8T or B and 7 to 1 representing cell antigen. T lymphocyte are activated and secreted interleukin 4, 5 and 6 and is activated in lymphocytes. And if T lymphocyte secretes interleukin 2 and T killer are activated. There are and humoral immune response and immunoglobulin and Ig has specificity and has ability to connect with antigen. IgM produced during the primary immune response. They are also the first antibodies of the newborn, don't cross the placenta, bind, complement, and activate it in the classical way. Antibodies fixed in the cell, and next, free circulation antibody in the liquor. In the primary immune response, antibody is determined 1 and 2 weeks after the introduction of antigen into the body. In this case, immunoglobulin M increases if the body has already responded and to this antigen. Repeated administration lead to the fast and more powerful response, and from secondary immune response this increase immunoglobulin G. This time and antigen connected with macrophage and T lymphocyte, T helper activated then activated T killer and cytotoxic T cell. T killer activated, and after T helper secretion cytokines, and under the cytokines activate B cell formation antibody, and after activate cytotoxic T cell and T cell and connected with a receptor, and finally cell and abnormal cell death. And thank you for attention. Take care.